Well, I discussed a few different trends that we kind of at HCA have pulled out that we're seeing kind of across the board with reform. One is the quality has a new imperative in future payment models. It's more important than ever. Providers are being evaluated against it more than they ever have before, and their ability to track and tell the value of their facility to a hospital is becoming vital for success. Another is this idea of being in a network, a preferred provider network. Whereas before it was kind of only something that happened within managed care, it's now happening in most of Medicare, most of Medicaid, and being able to prove your worth and value to a network of preferred providers is the only way you're going to be able to succeed. What that means is there will be winners and there will be losers. How that plays out is yet to be seen, but I think that the trend, the movement is definitely there. Reform typically starts with hospitals and physicians, where the biggest piece of the pie is, and it starts to bleed into other sectors. Post-acute care is one of those sectors where we're not brand new to the game, but we're farther along than other groups, specialty groups, for example, and we're seeing the same things in those downstream providers that we were dealing with just a couple of years ago. So it's inevitable, we think, that it will bleed into the entire healthcare system, but it goes in a certain order, and it happens at a certain pace. And the industry is in the midst of responding to a number of very significant proposed regulations right now. The next couple of months are going to be imperative to kind of follow and see what happens, what decisions the government makes, and to see exactly how providers will be impacted. I answered the call because I love talking about these issues. These issues are at the forefront of the industry right now, and I think that this panel with this group really met that bar in terms of addressing the issues that are most timely and relevant to the industry today.